Welcome back, everybody. It's great to have you here today on the Cabral Concept. Really important show. Today's show is Unmasking CIRS, or CIRS. It is chronic inflammatory, and this is really important. Like this is something that's extremely important that science has just started to talk about and really be open to, but chronic inflammatory response syndrome. It started to get talked about more during the pandemic and the viral-based post-inflammatory syndrome issues that people refer to as long COVID. But what it is it's an inflammation response in the body that at least 22% of the population is prone to. So when you look at that, what does it mean? Well, it means about a quarter of the population, right? A quarter of the population is prone to this. And I think that matters because when you're walking around, every 1 out of 4 people is susceptible to this. And that's because there's a specific HLA allele, right? I'll actually be talking about this on, I think it's Thursday's show, the Leon Heart study. So there's another allele called the ApoE genotype, but you either have a 2 or 3 or 4 and you get one from each parent. Well, those people with a 3-4, there's about 25 to 29% of the population. They actually don't do really well with higher fat diet or higher saturated fats. They can't clear it as well. It causes a lot more inflammation. So that's why everything you see online, like, oh, eat as much saturated fat as you want. Okay, yeah, a lot of the population, not as affected. Some of the population, greatly affected. Well, we've got about a quarter of the population that is more prone to inflammatory issues. I'll raise my hand because I'm one of those individuals, right? And so I just have to be more careful with managing inflammation in my body. Because I mean, I've had clients, they get a virus, they get a sickness, they're better in a day. My wife, she's better in hours. It's unbelievable. Her immune system just defies science. It's unbelievable. Mine, not so much. I need to work at it. I need to take my nutritional supplements. I can't overdo my exercise when I get a virus. Like, I have to be a little bit more cautious. Why? It's not because I'm not healthy, but part of my genes say, hey, if there's inflammation around, you're going to catch it. And again, I'm being kind of tongue-in-cheek there, but you're going to have a greater response. You're going to get puffy. You're going to get swollen. You're going to get a skin rash. You're going to get headaches. You're going to get, well, I'm getting ahead of myself. I want to give you some of these symptoms. But the nice thing is everyone's able to overcome it because your genetics are not your destiny. If they were, I would still have autoimmune issues. I'd still have type 2 diabetes, but I don't, right? So not only am I better now than I was in my 30s, I'm better now than I was in my 20s and my teens when I got this 30 years ago. So you can overcome anything. I truly believe that. You just need to have the awareness that this is even possible. That's why I do the show. All right, so let's go over it right now. Some of the biggest triggers for chronic inflammatory response syndrome, and then I'm going to get into the symptoms, are mold, which oftentimes we don't see. It's in our HVAC system, our vents, our air conditioners. It's behind drywall. It's in the offices. It's in the schools. It's from water damage, right? It's in some contaminated grains or things like that, or coffee, right, that isn't mold tested. Or it's from Lyme disease. Or it's from a viral-based issue you get, or other environmental-based toxins. So this is, again, important that we look at this, that we understand it, and I want to share with you, does this fit you? Are you one of these individuals maybe? Well, let's go through it. So the biggest thing that you're going to see around chronic inflammatory response syndrome, and I'll just call it kind of inflammation going forward, or chronic inflammation, is fatigue, brain fog, and memory problems. If you have those, then you're saying, okay, let me listen in. Let me listen on. Or maybe you're an integrative health practitioner or a health practitioner, and you have clients in your practice, and you might be exploring this for them. Well, what else might it be besides the typical fatigue in body, right? What's brain fog? Essentially fatigue in brain, and then we have memory problems. The body's so exhausted, so inflamed, that the memory isn't even working as well as it should. I'll get deep into that maybe another day, but I want to give you the overview to see if this might fit. And then we're, of course, going to go through the solution. Joint pain and muscle pain, sinus congestion, coughing, or shortness of breath, kind of clearing your throat, postnasal drip. It's inflammation, right? Digestive issues like bloating, diarrhea, or pain, meaning digestive pain. Headaches, migraines, sensitivity to light or smell or sound, right? The people that are always more sensitive. Skin rashes, right? Unusual sensitivities. This kind of sounds like what I wrote about in the rain barrel effect, right? For Th2 dominance. It's exactly what it is. The people that are more Th2 dominant, like me, but not my wife, who's more Th1 dominant, more susceptible to all the environmental things, more susceptible to the viruses, the allergies, the environmental and indoor allergies, the food sensitive, just more sensitive, right? And so when you look at that, it's good to know what category do you fall into. All right. Now, the thing is, I no longer even have allergies anymore. I never thought I'd have a life without allergies because I had allergies since I was like 6 years old, literally. I mean, I was going to an allergist since 8 years old. Legitimately. And so, I find that to be the most remarkable, truthfully, because even after I got well, I still had allergies in my I got well at 27. So I had allergies still like my very early 30s. Yeah, early 30s. But then I eventually got rid of those too. So again, you just keep, I'm using the phrase this week, but stacking bricks in your health, and not everything's solved overnight. Not everything is even solved in the 12 months. But you continue to do the right things and you do get well. All right, let me give you a couple more other symptoms. These are strange ones, but I've seen them in my practice. People talk all the time in my practice, because I work with some of the hard cases, buzzing or tremors or tingling inside the body. That's one that I get all the time. Numbness sometimes, like throughout the body. Now, again, there are other explanations for this. Maybe there's impingement in the neck, right? In the cervical base vertebrae. So there are other things. But if you're starting to stack up a lot of these symptoms, then this could be it. Odd tics or spasms, dyskinesis, we sometimes call this. Different shaking or seizure-like things, but it's not Parkinson's. It's not related to other nervous system-based issues. Fibromyalgia, sometimes dizziness, unexplained dizziness can be part of inflammation overall. And then I would say, atypical autoimmune issues. You're not showing up for autoimmune markers, but you're getting all the symptoms of nodules on your thyroid, inflammation of your joints like RA. So important to look at that. All right. So those are a lot of the symptoms. Testing, what can you do? Well, there's a few different tests. Like in my practice in Boston, so when I had an in-person practice, now it's all virtual, I would do a skin scratch test. I would look at blood under a microscope. I do all sorts of different things. I do a pupil dilation test. There's not a lot of great lab tests right now, but you can actually have more in-depth ones done, looking at everything from your interleukin 6, IL-6 base markers, MMP-9, C4a, TGF beta 1, VEGF, HLA-DR genetic markers. That's that HLA marker that I was talking about to see if you're more prone. But even if you're more prone doesn't mean that you have it, right? So just because I'm more prone doesn't mean I have any of these things. Just because I have methylation issues doesn't mean I have methylation issues. I have methylation issues in my single nucleotide polymorphisms, my genes, right? But I don't have any methylation issues. Why? Because I do the things to make sure that I'm balanced in that way. So again, you don't have to have any of these things just because your genes say that. All right. So here's the thing. In my practice, we don't do a lot of the investigational blood work at these specific markers because it may or may not show high for that day. So we look at it as the symptoms and we say, listen, I believe you. I believe that you have these symptoms. So now let's look for deeper underlying root cause. Because remember, it's coming from an exposure and a deficiency. I talked about this in the rain barrel effect. People become diseased, just like me, because of deficiencies and then toxicities. Let me just give you a couple of mine. I had crazy levels of mercury in my body. I had Candida yeast overgrowth. I had SIBO, which is bacterial overgrowth in your gut. And I had an H. pylori infection in my stomach and gut. Okay, so that's 4. Right off the bat. I had wild food sensitivities and leaky gut, and I had crazy mold exposure. So those are my toxicities that I just talked about. There are others, but we'll go with those. Then my deficiencies are wildly low zinc, low vitamin C, low magnesium, low B6, B9, and B12. Okay, those were crazy low, and magnesium if I didn't mention that. Okay, so I had deficiencies and I had toxicities. Guess what happened when my mentor helped me find out those deficiencies and toxicities? I got well, right? Not to make light of it, I got well because the human body knows how to heal. My mentor, and I'll do the same for people in my practice, I'll be the first one to say, I don't help people heal. Your body heals. I help you put your body in position to heal. So I run things like the Big 5 labs. I run things like the Vitamin Tox Test Starter Kit. I find out what your deficiencies and toxicities are. Then we replenish the deficiencies. We remove the toxicities. Lo and behold, the inflammation goes away. And then your body heals, right? So it's so important that we look at it that way. Now, there are also specialty tests that you can run at home. Food sensitivity test, the mycotoxins mold test, and if you wanted to look at your inflammation, your omega-6 to omega-3 inflammation test. So these are all available at stephencabral.com/shop. That takes you over to Equilife. You don't have to work with our team at Equilife. You honestly don't have to. You can work with any integrative health practitioner. You can work with your naturopathic doctor locally if you want. I just want you to know there's always a reason why you're unwell, and there's always a way to heal. Hopefully today's show was helpful. You can check out all the show notes at stephencabral.com/3406. I wish you all the best. Be well. I'll talk to you tomorrow. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.